This year, an estimated 70,000 Canadians will have hip or knee replacement surgery to regain their lives of movement. Research shows, and most healthcare professionals would agree, that the more you know about your surgery and your role in your return to mobility, the better your results will be. In hip and knee replacements especially, the patient plays a critical role in the preparation for and recovery from orthopedic surgery. This 3-part video series is designed to help you learn about your journey through the orthopedic care path and how you can be an active participant in your regained mobility.
While following surgery, patients need to focus on their comfort, healing, and recovery. In the first few days to weeks, it's very important to follow directions given by the healthcare team, the nurses, the physiotherapists, and the surgeon to ensure that the wound heals well and that there's minimal pain and discomfort. So you need to take your medications, you need to take any other prescriptions to reduce risks such as a blood clot, and to comply with the rehab instructions to get the best possible outcome.
The biggest concern post-surgery for me was how long would it take and would I reach the goal for getting the flexion and extension I needed to have a fully functional knee. When I was going through my recovery after surgery, one of the things I realized quickly is that I had to recognize what pain was normal pain and what pain was pain caused because I was actually hurting the joint or it was causing more problems. So once I was able to do that, the normal pain is just scar tissue being stretched, and it's a gradual pain that develops as you push harder and harder. The other one is a sharp pain, a pain that hurts right away. It feels like somebody's sort of sticking a needle into you kind of pain, and that I learned very quickly you don't push through and you don't work against.
Typically 10 days to 2 weeks after your surgery, you'll see your surgeon or your family physician to have your staples or sutures removed and check that the wound is healing properly and that you don't have any questions. After that visit, you'll begin to see the surgeon less often, and a checkup visit may be booked at anywhere from 4 to 8 weeks after surgery. And then 6 months later, you'll see the surgeon again to check up on your progress, and finally about a year later, you'll see the surgeon again, and on occasions, you'll see the surgeon more frequently. Generally, most patients' first question is, when can I return to my usual activities? While my skill as a surgeon is very important to replace the bothersome joint as skillfully and appropriately as possible, a patient's own motivation and willingness to recover as quickly as possible is the most important factor in a speedy recovery. It is extremely important for patients to work really hard to facilitate the recovery and to improve their rehabilitation. Unfortunately, with any operation, there's a fair bit of pain after surgery, and it's very easy for patients to say, I'm having a lot of pain, I can't really participate with the exercises because they're worsening the pain. But it's crucial that they work through the pain, take their painkillers, use things like ice to assist them in improving the pain so that they can work on their recovery. In addition, they might equate that the loss of pain as the pain improves equals full recovery, but that is not necessarily the case, and they may have to persist with their exercises until they've achieved their full recovery. And let's face it, an exercise program physiotherapy is work, and most of us have better things to do than to suffer through exercises, but it's absolutely crucial that these be complied with to achieve the best recovery. Patients should gradually increase their activities and continue with their exercise program to achieve the maximum potential that they can with their operation. It's also critical to note that very early on in the recovery process, the gains can be fairly large. However, later on, you'll be experiencing very small gains, and if you don't continue with your exercise program, you may not achieve those little gains that will allow you to achieve your best ultimate potential.
What was important was that I knew I had exercises to follow, and I knew you had to follow them to a T, and I did. I had to do exercises 3 times a day. I did them 3 times a day at home, but on top of that, I also had a physiotherapist that followed me, and I would go to see her 3 times a week, and I did everything that she had asked me to do, and then go home and redo them again.
When I was recovering, I did most of mine at home. I was fortunate to have a wife that was an orthopedic nurse, so she was able to assist me. I bought all the equipment myself. Not that there was a lot. There was only a ball and a tubing, and I bought a goniometer, which is a tool for measuring the knee. And so for me, I did everything at home, and I had one goal in mind. That was every day I had to improve by 1 degree. The key to successful knee surgery is the physical therapy that you do every day. And it has to start immediately, right away. As quickly as possible, you should be trying to move that leg as much as possible. That's painful, but without it, you won't get the degree of flexion and extension, which is critical to have a fully functioning knee. If you only get 90 degrees, you will have difficulty getting up from a regular chair. But if you get your 120 and up, which most people can get if they push through the pain, then you can pretty much do anything you wish to do. Since I've had the operation now, I don't have pain in my left knee, and it's actually compensated. My right knee was quite sore and no longer is, because now I walk normally. I can do anything I would choose to do. I avoid activities that are high impact or could cause injury, just because I don't want to ever have to go through that again if I don't have to. But I can do pretty much anything I want to do athletically, or even, around the house in the yard.
My new knee felt like it had never felt before. My knee had been bad for years and years, and to finally be able to walk around and without having any kind of problem was wonderful for me. So it gave me a new lease on life, basically. I could get up and down stairs. I had not been able to walk upstairs or downstairs for the longest time. I would avoid a curb. I would walk a long way so I didn't have to step up a curb. Now I could step up a curb. Prior to the surgery, I heard someone say, it'll take a year before you can really get back. But it depends on your muscle tone, how well you are working that muscle in order to get better quicker.
When you're getting ready for your surgery, learn as much as you can about the process. Find out about the recovery. Try and understand the different pain levels so that you're prepared to fight through the stretching kind of pain, because that is the key, is your ability to overcome what feels like I can't do this. You have to make yourself believe absolutely you can, because everybody else is doing it. And if they can do it, you can do it. And if you can do that, you'll be successful in getting the flexion and extension you need.
If in doubt about what to expect, it's important to talk to your surgeon or to talk to a fellow patient who had a similar operation. You can contact these patients through the Canadian Orthopaedic Foundation's Peer Connect program, also known as Ortho Connect, and that can be invaluable in getting some insight as to what to expect with the operation.
Patients receive paper or verbal instructions for how to prepare for their procedure. These instructions are often lost, forgotten, or difficult to follow. Poor compliance leads to avoidable cancellations and patients poorly optimized for their procedure. In hospital, with limited staff time available for patient education, such as for early mobilization, poor compliance is often inevitable and causes longer lengths of stay. Upon discharge, patients are sent into what feels like a black hole with limited support for recovery and no way to track health status to intervene sooner for signs of complications. This leads to avoidable ER visits and readmissions. With the continued shift to value-based care, providers tell us we need a better way to engage, monitor, and optimize patients without taking up more staff time. SeamlessMD is your all-in-one platform for patient engagement, remote monitoring, and virtual care used by the leading health systems across North America. The patient app is available on a patient's smartphone, tablet, or computer and guides patients before, during, and after hospitalization. With SeamlessMD, patients get reminders to stay on track with protocols, education designed to improve comprehension, and the ability to report recovery information. This helps them to feel less anxious, more engaged, prepared, and connected to your care team, and ultimately require far fewer hospital resources. Providers deliver better outcomes with SeamlessMD. They can monitor patients, intervene sooner for patients at risk, and collect data from patients across the episode, such as compliance, pain, wound photos, and other patient-reported outcomes proven to improve care. Leading health systems that use SeamlessMD have reduced length of stay by 1 to 2 days, readmissions by 20 to 66%, skilled nursing facility use by 25 to 60%, and ER visits by up to 47%. Most importantly, patients are far more satisfied with their care. So, what would it look like if your patients got the right care at the right time? It would look like SeamlessMD. For more information or to contact our team, visit seamless.md.
At New England Baptist Hospital, we take every precaution to lower your risk of infection during surgery. That's why before your procedure, you'll wash with a special cleanser called Chlorhexidine, which you can buy over the counter at your local pharmacy. Follow these directions to ensure that you use this cleanser correctly. Starting 2 days before your surgery, you will begin showering once a day with the Chlorhexidine for a total of 3 showers. Your last shower will be the day of surgery. Begin by washing your face and hair with your regular soap and shampoo. Then turn off the shower or step out of the water stream to apply the chlorhexidine. Put the chlorhexidine on a clean wet washcloth or use your hands to apply the cleanser. Apply it to your whole body from the neck down. Pay special attention to your underarms, under your breasts, your groin area, where your legs meet your torso, and the area where you're going to have surgery. Avoid your face and genitals. You should use an entire 4-ounce bottle of the chlorhexidine for each shower. After applying the chlorhexidine, let it stand for 1 minute prior to rinsing. Rinse the chlorhexidine off your body. Then gently blot your skin dry with a clean towel. Put on clean pajamas or clothes. On the morning of your surgery, do not use any lotions, creams, powders, perfumes, or oils after your shower. You may apply deodorant. Additionally, starting 5 days before surgery, you'll also apply an antibiotic ointment called Mupirocin to the inside of your nose. The nurse practitioner will call a prescription into your pharmacy. First, place a pea-sized amount of the ointment to the end of a Q-tip. Gently apply the ointment to the inside of each nostril. This shouldn't hurt. The Q-tip should only be inserted about a ½ inch, or the size of the head of a Q-tip, into the nostril. Apply twice a day, starting 5 days prior to your surgery. The last dose will be the morning of surgery.
Different choices have different results. Which would you choose? Painful staple removal or no staples at all? Bulky bandages or no bandages required? Waiting to shower or showering immediately after surgery? Train track scar or no train track scar? Choose Dermabond Prineo Skin Closure System instead of skin staples. Here's how it works. A lightweight mesh is applied over your incision and then coated with a skin adhesive to form a strong, flexible seal. A watertight barrier blocks water and bacteria from entering the wound, and then it falls off naturally, unlike staples which can be painful to remove. Enjoy an optimal wound healing environment, easier aftercare with no dressings to change, and greater post-operative comfort. Hear what Dermabond Prineo patients have to say.
It's just so much more convenient. You can shower, you can get it wet, and you lead more of a normal life. After the Dermabond Prineo came off, it was wonderful. It's such a fine scar line.
Enjoy greater satisfaction with the appearance of your scar. Get back to the things you love in no time. You have options. Ask about Dermabond Prineo system today.
The powerful Game Ready system provides optimal therapeutic benefits following injury or surgery. The dual action wrap combines cryotherapy with intermittent compression. These actions together help reduce fluid and limit bleeding within the joint that can cause pain and swelling. At the tissue level, blood vessels constrict and fluid outflow into the interstitial space is reduced. Cryotherapy can reduce the number of white blood cells that migrate to the injury or surgical site, reduce their release of inflammatory chemicals, and help slow down the conduction of pain nerve signals. In combination, these therapeutic benefits reduce pain and swelling and help lower opioid use. To learn more about the Game Ready system, visit us at GameReady.com.
So today we're here with a full function rehab patient to discuss her knee operations and knee replacements. She previously had a knee operation a couple years ago using just general ice packs and therapy. This knee replacement that happened more recently, she rented the product called Game Ready, which is an ice compression machine. So we have our patient here just to tell us the story of how she was feeling with the Game Ready machine and the difference with her recovery. So thanks for coming in today.
You're welcome.
If you'd like to discuss with us just general history of when you had your first knee operation.
Okay.
And then you could tell us about your more current knee operation and using this ice compression device.
Okay. Hi, my name is Sedalia. I'm a patient at Full Function Rehab. I had a knee surgery 2 years ago, and I just used basic ice. And my recovery was terrible. I had a lot of pain. I was in pain for months. The swellingness went from my knee to my ankle, and it was terrible. Someone had told me about this Game Ready machine, but I didn't think much about it because I didn't know about it. So I was kind of hesitant to order it or like rent it. So I just let it go, and then just this year in February, I had another knee replacement, and again, someone told me you should look into this Game Ready machine, and so I did. It's a little bit pricey to rent, but it's worth it. My experience this year with it was phenomenal. All you need to do is add a little bit of water to the machine and then fill it up with ice, and it's pretty much set for you. You just start it, and half an hour twice or three times a day, and you wouldn't believe how much results you get from this machine. There's a lot of like your swellingness goes away very quickly. The pain is unbelievable. With this surgery this time, I would say within about a month, 3 weeks to 4 weeks, I was feeling great. As to 2 years ago, which I was good after like 3 months, and I was still having problems. But this one is, I highly recommend this to anybody that has a knee replacement. It also does a lot of other things. If you have like back surgery or hip replacement, there's different devices that you could use with this machine, and I highly recommend it. And I just hope that more people try this. And yeah, I don't know what more to say. It's wonderful. I was kind of hesitant to get it, but I decided to get it, and I'm very happy that I did. It's just remarkable. I don't know more to say. And thank you again for allowing me to do this, a full function rehab. And the people here are wonderful. And yeah, come and check them out. Check this out. Go onto the website. Again, that's all. I don't have much more to say.
Yeah.
Thank you.
No, that's great. Thank you. And just a question. Can you describe what it feels like when it's...
Oh, yeah. When you put it on, it's sort of like a glove. You kind of wrap your leg on it, and you turn on the machine, and then it kind of tightens, and then you get like this coldness coming up, and that cold stays consistently there. It's not like you put it on and then it gets warm. And I found that once I filled up the machine with ice and a little bit of water, it would hold for 2 sessions. Like I could use the machine twice and it was still very cold. And yeah, it's wonderful. So you just wrap it, put it on, relax for half an hour. It'll turn off on its own, and it's the best.
Great. So do you find that compression would go up and down?
Yes.
Yeah, great.
Yeah.
Okay, great. Well, I'm glad you had a great experience with the machine. Thank you for talking about your
You're
experience
welcome.
with it, and we appreciate it.
You're welcome. Thank you so much.
Welcome to the Game Ready Hip Groin Wrap application video. Game Ready uses Axel technology to apply cold and active pneumatic compression therapy designed to help you recover from your injury or surgery as quickly as possible. This video will demonstrate how to apply your hip groin wrap. Place your left hand above the left hip outside label and your right hand above the left hip inside label. Wrap the left hip inside flap over the left thigh and hip bone, then attach the left hip outside flap over the left hip inside flap. Secure both the top and bottom flap. Bring the back strap behind and around your waist and attach. There is an optional flap for the groin area that can be folded back, which attaches to the hook. For instructions on other Game Ready wraps, you can view our other videos at youtube.com/GameReadyUSA.
Niagara Health Foundation fundraises to help our local hospitals and healthcare teams deliver the best possible healthcare in Niagara. The foundation helps fund urgent patient care needs, like equipment that is not funded by the government. From MRI machines to defibrillators, ultrasounds to hospital beds, and everything in between, the need for equipment is always growing. With the help from our community, you can support extraordinary healthcare close to home in Niagara. Visit NiagaraHealthFoundation.com to make a donation and learn how you can support a healthier Niagara.